Let's get started. What's up, guys? My name is Dr. Alex Tatum, and I'm a fellowship-trained urologist specializing in male, sexual, and reproductive medicine. And today, we're going to answer a very important question. What is men's health? Let's get into it on Season 1, Episode 1 of The Man Cave. Thank you so much for joining me. It is my hope that this series will serve as a resource for both patients and healthcare providers that are seeking to learn more about men's health. We'll have general education videos, answer any specific questions that you may have, and also feature surgical videos so you can see what it is that we actually do in the operating room to improve men's lives. But back to the topic at hand. What is men's health? What does that phrase even mean? What used to be a complete non-entity has turned into one of the biggest buzzwords in modern medicine. You can't look at the news, a magazine, a billboard, or even your phone without seeing some sort of advertisement for men's health. So today we're going to talk about what men's health really means, how it relates to a specialist like myself, and why it is so important to men and those who care about them. Now, there is a lot of confusing information out there, but at the end of the day, men's health simply boils down to this. What are the healthcare needs unique to men? Generally, these are what we like to call the 4 S's, and those are stream, steroids, swimmers, and sex. Now, while there's a lot that men and women have in common, like heart, liver, or lung disease, parts of our bodies are made differently, which is why men's health exists as a field. Number 1 is stream, aka the prostate. Men have this donut-shaped gland that sits in front of the bladder and that the urine passes through, called the prostate. It helps make the fluid that makes up a man's ejaculate, but the challenge is that it never stops growing. This means that the donut can grow both out, making the prostate bigger, and in, making the channel that urine flows through smaller. This condition is known as BPH, and it can really make it difficult for men to urinate and empty their bladder. This means straining to empty, multiple trips back and forth to the bathroom, waking up several times a night, and always looking for the next rest stop when driving down the road. Treating BPH is one of the bedrocks of general urology, and we have a number of great treatment options for this. Now, where stream enters into my practice as a specialist is with urinary leakage after the prostate has been removed for prostate cancer. This is known as male stress urinary incontinence. Prostate cancer, which is not related to BPH, is the most common cancer in men and is frequently cured by removing the prostate. But this can have several side effects, and one of these being urinary leakage. Depending on your definition, this may affect anywhere from 1 to 40% of men after prostate removal. Although devastating, we can actually cure most men of this and help them get their lives back with small outpatient procedures, known as an artificial urinary sphincter or a male sling. Now, our second S is for steroids, also known as testosterone. Testosterone is the fuel that makes men men. Think of a lumberjack cutting down trees or Arnold Schwarzenegger, but think a little bit more Terminator and a little less Governator. Testosterone is made by the testicles as the end product of a complex series of hormonal interactions that starts in the brain but ultimately affects the entire body. Testosterone promotes muscular development, fat loss, mental clarity, healthy libido, and even improves overall mood and sleep quality. But when a man is deprived of testosterone, all of these things can go off the rails. This condition, known as hypogonadism, testosterone deficiency, or low T, is increasingly common. Although testosterones are known to naturally decline with age, recent studies estimate that up to 4 out of 10 men may have clinically low testosterone. This puts them at risk for obesity, diabetes, sexual dysfunction, and even depression. So if you're experiencing any of these symptoms, it's important to be formally evaluated by a specialist who not only understands testosterone, but also its effects on fertility, which brings me to our next S. Our third S is for swimmers, or for sperm. Fertility is a problem that's becoming more and more of an issue for young couples. Approximately 1 in 8 couples will experience difficulty conceiving at some point in their relationship. Although our society has traditionally laid the blame for this on the female partner, the truth is that there's actually an issue with the male partner at least 50% of the time. So if you and your partner are experiencing difficulty starting your family, it's important that you both seek out evaluation by your respective specialists. For women, this starts with a basic evaluation by a gynecologist with more advanced testing and treatment from a specialist known as a reproductive endocrinologist. But for men, they should be evaluated by a urologist with specialty fellowship training in male fertility. This includes doctors like myself or my partner, Dr. Jason Kovac. This sort of evaluation typically involves checking a man's sperm count, hormonal testing, and a physical exam. But there are many more advanced tests, including things like genetic testing, sperm DNA fragmentation, ultrasound, and each of these can affect the decision-making process when discussing treatment. Long story short, fertility is complicated, and couples do their best when they're evaluated by someone who does this sort of thing every day. Our final S is for sex. Men can face a lot of challenges in the bedroom. These include premature ejaculation, delayed or absent orgasm, decreased libido, Peyronie's disease, and erectile dysfunction. Although a lot of doctors may not feel comfortable discussing these issues, the truth is these are problems that can be extremely isolating to both men and those that they love, and they are much more common than most people may think. For example, up to 50% of men over the age of 40 will experience some form of erectile dysfunction. That means that if you see a man with a little bit of gray in his hair, it's a coin flip whether or not things are working in his personal life the way he'd like them to. Now, most people are familiar with medications like Viagra or Cialis, but these medicines actually fail in 30 to 50% of men. Even when they do work, they typically have to be taken at least an hour ahead of time and on an empty stomach. This robs men of any sort of spontaneity. It can make sex a significant source of anxiety. I cannot count the number of times my patients have described to me spending their entire evening leading up to sex just praying that their little blue pill pulls through and they're able to perform. Other options, like penile injections or the vacuum device, are painful and even less convenient. This is why I've dedicated a large portion of my practice to curing men of their erectile dysfunction with a simple outpatient procedure known as the penile implant. At our practice, we've created a dedicated center of excellence for the implant where men can be offered the best possible outcomes with minimal downtime and side effects. Now, we'll have a lot more videos talking about erectile dysfunction and the implant, but the short version is this. Rather than having to rely on a pill or a shot, the penile implant is an invisible and lasting cure for erectile dysfunction. As a result, it has become the undisputed gold standard for restoring men's sex lives. So these are our 4 S's that make up the core of men's health. I hope this video was educational and offered insight into a phrase that is often quoted but not often explained. If you like this video, make sure to like and subscribe for more regular content. Hit that notification bell and leave a comment. Until next time, this is Dr. Alex Tatum signing off from the Man Cave.